Hi, everyone. My name is Kate Peeling Porter. My pronouns are she, her, and I'm the Senior Program Manager at Twin Cities Medical Society. And today I'm chatting with some U of M medical students, and they will introduce themselves.
Hi, everyone. My name is Allison. I use she, her pronouns. I just finished my first year of medical school at the University of Minnesota, Twin Cities campus, and I'm going to be a TCMS Public Health Advocacy Fellow this year.
Hi, my name is Anna. I also just finished my first year, and I was a TCMS fellowship member last year.
Hi there, my name is Miranda. I use she, her pronouns. I am a rising second year medical student at the Twin Cities campus, and I will also be a TCMS Public Health Advocacy Fellow this year.
Thank you all so much, and super exciting with your connections to the fellowship. So today we're talking about harm reduction. So my first question for the three of you is, what is harm reduction and why is it important?
Yeah, so harm reduction is a framework. So it's a set of practical strategies and ideas that aims to reduce the negative consequences associated with drug use. So it's this like practical toolkit, but it's also at the same time a social justice movement started and led by people who use drugs. And it's built on this belief in and respect for the rights of people who use drugs. So this whole harm reduction situation could manifest in a lot of different ways. So like maybe it's Narcan education and distribution, maybe it's supplying people with sterile syringes, maybe it's infectious disease testing, increasing access to fentanyl test strips. All of these things fall under the harm reduction umbrella. And I always like to say like harm reduction itself is specific to drug use, but its ideology kind of permeates the rest of our society. So my favorite example is like bike helmets and seat belts. So we don't tell people to never drive again because it's dangerous or achieve abstinence from biking because it's dangerous. We just give them tools to make them participate in those activities more safely. And then just on top of that, it's also just an evidence-based, well-researched solution that prevents morbidity and mortality associated with drug use. It's criminalization, all of that. It saves money, and most importantly, it saves lives.
Wonderful, thank you so much. And I think that analogy is really helpful. That kind of analogy is helpful in so many public health scenarios. So I think really bringing it home is really helpful. So what are some of the goals of the work that you all do in harm reduction?
Yeah, so we've been partnering with Southside Harm Reduction Services. They're a community organization in Minneapolis, and they're out in the community pretty much every day doing this harm reduction work, working within this framework. So that looks like delivering supplies for safe use, Narcan for overdose reversals, infectious disease treatment and testing and referral to care, and then community building, just to name a few of the things that they do. But kind of our work within this is especially to provide education and advocate for this harm reduction framework, especially the initiatives that need the most advocacy and support. So one of those initiatives is an overdose prevention site, which has existed kind of around the globe for several decades, and are starting to be opened in the United States in places like New York and California, but they're currently not legal in Minnesota. So we're just looking to increase advocacy and education around those. These are really well evidence-based public health initiatives that provide a safe place for people to use drugs with people who are working in healthcare on site so that they can reverse overdoses and deal with any problems there. But it also just provides people a safe place to go. Yeah, so that's our first goal.
Yeah, our second goal working with the Southside is to actually help them establish their own physical location, which will be called a drop-in site. So a drop-in site is a place where people could come and pick up these harm reduction materials when they need it, instead of Southside Harm Reduction Services only being a delivery service as it is right now. And the establishment of the drop-in site would allow Southside to expand its services to include things like meals, having a place where people can charge their phone, and even on-site showers. Southside has really built deep connections with the substance use community here in the Twin Cities, and they've actually conducted surveys to show that the community wants this space too. And a drop-in site is a fully legal entity right now in the state of Minnesota. Southside just needs the funds to help establish this location.
Wonderful, thank you. So kind of lastly for today, how can people get involved and support harm reduction efforts in Minnesota?
Yeah, the best way that people can get involved in harm reduction is really committing to learning about it first. So educating yourself, your patients, and your community. That looks like staying informed about harm reduction strategies. So explore what's available to you as a healthcare provider and what implementing harm reduction tools and methods in your clinical setting could be. And by staying informed about harm reduction, you can educate patients who may not know about harm reduction services to keep them healthier and connect them to resources like Southside. Also, I want to mention that advocacy is going to be really important, a really important way to get involved in the harm reduction movement, especially right now. We need healthcare support in working towards the legalization of an overdose prevention site in Minnesota. Other cities have already opened sites in the United States, and Minnesota could follow. And like I mentioned earlier, finally, the most direct action, someone could take right now is financially supporting organizations that have already been working in harm reduction spaces for years, like Southside Harm Reduction Services. Southside is currently accepting donations with the ultimate goal of building a drop-in site, like I mentioned, and this will just be a critical step in continuing their established presence in the community. And donations to Southside can be made at their website, which is southsideharmreduction.org/donate.
Wonderful. Thank you all so much. And we'll be sure to link to Southside's website as well when we publish this video for everyone to see. It was great talking to you all. Thank you for your work on this, and we're really excited to work together.